Hello, everyone, and welcome to this Global Healthy Living Foundation and CreakyJoints Facebook Live session titled Stay in Touch with Your Health Provider, Stay on Track with Your Health. I'll be your moderator for today's session. My name is Shilpa Venkatachalam, and I'm the Associate Director of Patient-Centered Research at the Global Healthy Living Foundation. I'm also the co-principal investigator on our research registry called Arthritis Power, which is a patient-powered research registry and network for patients living with all kinds of rheumatic and musculoskeletal conditions. Last but not the least, I am a patient myself. I live with rheumatoid arthritis. And so I want to take a moment to thank our audience today and the CreakyJoints patient community for the many questions that you have sent us over the last few weeks in preparation for this event, because these are exactly the same kinds of questions that I have myself as a patient. This event is being conducted in collaboration with the Centers for Disease Control and Prevention, or the CDC, and United Rheumatology, and we are delighted to have scientific experts from these two institutions on our panel today. While we're very happy to welcome our panelists today, it has been a challenging time for us globally, and a particularly grim week in the United States, where we have now crossed the 100,000 mark for the number of patients and people who we have lost to the virus. These are sons, daughters, sisters, brothers, parents, partners, first responders, and frontline workers. This month also marks Arthritis Awareness Month, and so for all these reasons and many more, the discussion today is particularly important. I know we're all very eager to jump right into it. So without much delay, let's get started with introductions to our excellent panelists for today's event. But even before that, I just want to say a special thank you to our partner organizations for their help and support in this event. Lupus and Allied Disease Association, LADA, Myositis Support and Understanding, AIDS United, the Accelerated Cures Project and I Conquer MS, and American Bone Health. We remain grateful to you for our partnerships and collaborations. So now for the interesting bit. We have Dr. Ann Kimball from the CDC and Dr. Max Hamburger from United Rheumatology. I'm going to pause for a moment today and ask them to provide a brief introduction to themselves. So I'll ask you, Dr. Ann Kimball, first to introduce yourself, and then we'll go on to Dr. Max Hamburger. Ann?
Hi. Good afternoon. So nice to have the opportunity to speak with you today. I hope that you are all doing well during this difficult time. As Shilpa said, my name is Dr. Ann Kimball. I am a pediatrician, and I have my master's in public health. I work for the CDC in Atlanta. I've been working on COVID-19 since early March. This is actually my 6th week working on the at-risk medical conditions team in CDC's COVID-19 response. As you can see, I'm maintaining social distancing by working from home. Welcome to my home office. In my normal job, I am an Epidemic Intelligence Service Officer, or an EIS officer, for CDC in the Division of STD Prevention. I also see patients as a pediatric hospitalist. I hope we can provide you all with some useful information today.
Thanks, Ann. Delighted to have you. And Dr. Max Hamburger, can I ask you to introduce yourself, please?
Sure, Shilpa, and thank you very much for asking me to participate today. I'm a rheumatologist in clinical practice. I've been in practice for over 40 years. My practice, Rheumatology Associates of Long Island, serves patients from New York City out to the eastern end of Long Island. I've got 12 partners. We've got 5 offices and take care of the broad array of patients with rheumatologic disorders. I went to Rutgers, trained at the Albert Einstein College of Medicine, and then NYU Bellevue, and then was very fortunate, particularly given current circumstance, to train at the National Institutes of Health, where I did a program that bridged from National Institute of Allergy and Infectious Disease, where I actually shared a lab right across the hall from Tony Fauci, and then also spent time on the arthritis branch, and then qualified to sit for the boards. And run my practice as managing partner for the last 40 years, and then about 6 years ago founded United Rheumatology so that rheumatologists across the country could have a way of sharing their expertise on behalf of their patients and try and find value in the best possible care for our patients. So thank you for asking me to join today.
Thank you, Dr. Hamburger. And as you can see, I need say nothing more. We're very grateful to have very, very distinguished guests today on the panel. So I won't delay this very much further. I do want to say that the most important participating member in today's session is our audience, people living with chronic diseases from across the country and internationally who are joining us today, and we owe them a special thank you. A few quick words about how today's session will work, and we'll move right on. Prior to this event, we asked patients living with chronic underlying conditions like rheumatoid arthritis to send us their questions. And then over the past couple of weeks, we've been putting these questions together. Of course, we've received very many questions, as you might well imagine, and we want to try and answer all these questions. But because of time constraints, we might not be able to get to your question today. And for this, we apologize in advance. However, realizing the urgency of your questions, we will find a way to address your questions on our website, CreakyJoints. And so we'll post any pending questions to our website on CreakyJoints. So stay tuned. And one way for you to stay tuned about these pending questions that we might not get to today is by visiting us at www.ghlf.org. Or you might even consider joining GHLF's free patient support program. This will keep you also informed about other opportunities like this one. So with that, let's get started to the interesting bit. So I want to start with you, Dr. Kimball. I'm wondering, just to get us started here, if you can provide a brief overview on COVID-19, different terms that are swimming around, SARS-CoV-2, COVID-19. What is this virus? How did it all start? And what does it mean when we say that certain people are at higher risk of severe illness from COVID-19? Dr. Kimball?
Thank you. That's a very important question to start off with today. So COVID-19 is a new disease, and it's named COVID-19 for coronavirus disease 2019. It is caused by a new kind of coronavirus called SARS-CoV-2, which was first discovered at the end of last year. Now, this virus spreads from person to person. You can get it by coming into close contact with somebody who is infected when that person coughs, sneezes, or talks. It's also possible to become infected with SARS-CoV-2 by touching an object or a surface that has the virus on it, and then touching your mouth, your nose, or your eyes. Some people who are infected with SARS-CoV-2 may not have any symptoms at all. Some have mild illness, and some have severe illness. The symptoms of COVID-19 are cough, shortness of breath or difficulty breathing, fever, chills, shaking with chills, muscle pain, sore throat, and a new loss of taste or a loss of smell. Most people with COVID-19 have mild illness and will recover at home. However, some people do develop severe illness, and that means that the person is sick enough to be in the hospital. They may need to be in the ICU or be put on a ventilator. And unfortunately, some people do die of COVID-19. The emergency warning signs that should make you concerned that you have severe illness with COVID-19 include trouble breathing, chest pain or pressure in the chest, new confusion, inability to wake up or having trouble staying awake, and a bluish color of the lips or the face, which is a sign of low oxygen levels. If this happens, you should call 911 or seek emergency care immediately. Emergency departments have plans in place to help protect you if you do need emergency care for any reason.
That's great. Thank you for that. Always good to have an overview before we dive right into specific questions. So, we've been hearing a lot about people who are at a higher risk or who have underlying conditions that might make them immunocompromised, for example. What is your advice? What should they do to protect themselves?
So we are learning new things about COVID-19 really every day, but we do know that older adults and people of any age who have certain underlying medical conditions are at higher risk for severe illness. The underlying conditions that put people at higher risk include chronic lung disease like COPD or moderate to severe asthma, heart conditions like heart failure and coronary artery disease, obesity, diabetes, chronic kidney disease, liver disease, and as you mentioned, immunocompromised conditions. Conditions that cause somebody to be immunocompromised include being on cancer treatment, having a blood or a bone marrow transplant, or a solid organ transplant, such as a liver or a kidney, and having an immune deficiency. Also, having HIV and taking corticosteroids for a long time, or taking other immunosuppressive medications. Immunosuppressive medications are often used for autoimmune diseases like rheumatoid arthritis. So people with any of these conditions I just mentioned, if you get sick with the virus that causes COVID-19, you may be at risk for becoming very sick. You can look on CDC's website for this long list of conditions that I just mentioned, and we actually will be updating this list intermittently as we learn more information about COVID-19. Now, to get to your main question, what should you do if you have these conditions? So we do recommend that you continue to take your medications exactly as prescribed. Please don't change your treatment plan without talking to your healthcare provider. Stay home as much as possible, and if you do leave your home, try to stay 6 feet away from other people. Wash your hands often, especially when you get home from being out. Also, clean and disinfect things that you touch frequently, like doorknobs and your cell phone. Try to have at least a 30-day supply or more of prescription and non-prescription medications. And avoid going on cruises and taking any non-essential trips on an airplane at this time. If you do have any concerns about your underlying conditions, or if you think you might have COVID-19, please reach out to your healthcare provider.
Again, thank you so much. That's great information. And, I just want to pick up on a few things that you mentioned. So we are talking about people who live with underlying conditions, many immunocompromised. I think of myself as someone living with rheumatoid arthritis with an underlying condition. And obviously, there's a lot of anxiety and fear, right, about going into a doctor's office. And we've learned through research and through data that's coming out that a lot of people are not wanting to go into doctors' offices. So what is the advice from experts like you, from scientists like you, about how people can manage their underlying conditions, especially if they experience a worsening of symptoms or new symptoms related to their chronic condition? They might be very nervous. It's a very important thing to acknowledge the patients are, myself included, are very nervous to go into the doctor's offices at this time because nobody wants to take on the risk of getting COVID-19. So what is your advice? What should they do in this case?
So the most important advice would be to contact your healthcare provider if you have any concerns about your health, whether it's about COVID-19 or about your underlying condition. Your provider may set up a visit with you over the phone or over a different telemedicine method, or they may schedule an in-person visit. And that decision will be made by you and your provider, and it depends on what your concerns are, whether you should be assessed in person, and really what the level of spread is in your area. It's always best to get in touch with your healthcare provider, and together you can decide the right course of action to keep you as healthy and safe as possible. The CDC does have guidance for healthcare facilities so that they can provide necessary services while minimizing risk to patients and to the healthcare personnel who work there. So please ask your healthcare provider's office what measures they have in place to help protect you when you do come into the office. And remember, as I mentioned before, if you have a medical emergency, don't delay calling 911 or going to the emergency department. It is very important to seek immediate medical care for emergencies to prevent permanent damage or even death. Emergency departments, hospitals, and doctors' offices all have prevention measures in place now to help keep you safe when you do need emergency care for any reason.
Great, and so that seems to be the resounding message is don't ignore any worsening of symptoms, don't ignore any new symptoms, get in touch with your healthcare provider. If it's an emergency, call 911. Dr. Hamburger, you've been sitting there very patiently, and I want to segue now to you with my next question. So, we've been talking about how to how patients can address this anxiety or fear of going into a doctor's office. Can you perhaps talk a little bit about what kind of measures are in place to ensure safety of patients when they're going into providers' offices? Maybe you can share some of the things being done in your clinics or in clinics with, within the United Rheumatology practice.
Sure. So I think the first thing to underscore here is that all of us put the safety of our patients and their staff as our first priority. And so patients will get a clue as soon as they contact the office about how we view that, because we're going to ask a lot of questions about them that go to the issue of safety. We are reciprocal in this need, because I got to keep my staff healthy, so they're there to be there for all the patients. So we've taken a lot of steps that look at the flow from the patient from the parking lot into the office and back out again. We've looked at every step along the way. Many of us have really not used our waiting rooms during this time. The parking lot becomes the waiting room. And so we may do an initial intake over the phone and get information that normally would have been gotten at the front desk. We'll call the patient in when it's their turn. There may be no other patient in the office at that time. And then we will question the patient for any symptoms or signs of infection. Then when they do get into the office, we will have advised them ahead of time. We're going to check their temperature. We're going to ask them to have a mask on. There are dispensers of hand sanitizer everywhere, again, for both patients and staff. If there's a need, we'll talk to them about cough etiquette. We take a great deal of effort in between every visit to go in and clean the exam rooms. And so whereas I used to have 2 exam rooms that I would use and a patient waiting in each one, now there's patient 1, the staff's in there cleaning the other one. We do our laboratory testing in the exam room rather than having the patients go sit in the waiting area in front of the lab. Same thing goes for x-ray. So what it translates into is that the hours that my staff are there are much longer because we have a much less flow into the office. And I think we'll come to this in a little bit, but we've also done everything we can to only bring the patients in who have to come in. The rest of the patients we're trying to manage as safely as we can via the telemedicine approach.
That's great. And it's really assuring to hear the clinician side of things for patients, including for patients like me, to know what's being done to ensure the safety of patients, of clinicians, your staff as well. So thank you for sharing that with us. I suppose the next logical question then is, why is it even important right now for people with underlying conditions to continue getting care? And what I mean by this is, why can I not say to myself, for example, you know, let me just wait for this to pass. Let me just wait for the pandemic to get better. Let me just wait for things to get safer, and I'll then go back into the doctor's office and take care of my underlying condition. Why is that not advisable to do?
There are a lot of reasons for those questions, and those are very, very important questions. First of all, there are some things we just don't know. We don't know how long this pandemic will last, and so waiting it out, that maybe will be this summer, or maybe it will be much longer than that. So waiting it out could be a really long time. It's important to stay with your physician because there is much that we are still learning about this disease. We're learning a lot about how this disease causes its damage. We're learning particularly, in certain age groups that there are things that we don't usually expect with infections. And so, the issues that have happened in kids in particular with the multi-system inflammatory disease, a lot of the symptoms that patients could get from early COVID-19 could be symptoms that they might confuse with their illness. They might feel tired. They might feel achy. They might not be sleeping well or be sleeping a great deal. Some patients with rheumatologic conditions have lung involvement. They might feel shortness of breath. So for a patient to figure out what's what in this situation may be very hard. It's something that's still a challenge for physicians. So this is a time to get on the phone and call us much more than ever. because we need to hear what's going on, help the patient see, is this their rheumatologic condition, or is this a comorbid condition, or is this COVID? And the only way we're really going to sort through that is if we have an active conversation, not have the patient stick their head in the sand and say, I'll come out when it's okay, because that's going to be a hard judgment.
Great, and I'll take the liberty of summing that up and saying, so what your advice is, patients should decide if or not something is important enough to see their clinicians. When in doubt, ask your clinician, communicate with your doctor. Is that correct?
Absolutely. This is not a time to ghost us. This is a time to talk to us more than ever. And I think every physician has recognized that. So in the past, people might have complained, gee, I can't, it's hard to get a call back. We've doubled our staff, as have most physicians, certainly in United Rheumatology, but I think many physicians have recognized we have to have a much higher level of communication. So we've doubled our staff to answer those calls and answer them live so we can answer patients' concerns.
Great. And could you provide a few words on telehealth? So we've been hearing a lot about telehealth in the past few months now. And patients are accessing telehealth increasingly over the last few weeks at least. How do patients know when to use telehealth versus when to go in person to see their doctors? Is there a golden rule? How do we make that judgment?
So telehealth became the prevailing way of us interacting with patients, not just rheumatology, but I think most physicians within a remarkably short time. We went from nothing on Friday, the 12th, whatever, to Monday, the 16th, and everybody was doing telehealth. Thankfully, the technology enabled us to do that. So how do you know? Well, I think for most offices, it's being done for the patient. So every day we look at next week's patient, tomorrow's patients, and we say, okay, we think we can handle this in the office, or no, we can handle this through telemedicine. So somebody, for example, who's on a medicine for osteoporosis and we see them once a year and they get their bone density test, probably we don't need to see them or touch them. Surely one of the things that I think all of us have learned during this, although telemedicine has helped us a ton, I really like sitting in the room with my patients. There's just something you get from sitting there and looking at them and talking to them and vice versa. So the audio-visual approach is really important. I know some patients say, I can't do this technology. I'm just going to get on a phone call. I need to see my patient's face. Sometimes I need to have them go through a range of motion or hold their hand up and I look at it. Is it swollen? So we do the best we can not to bring patients in at this point in time. We do the best we can to let them stay at home, even though we've taken many steps to make the office safe, both for the patients and for the physicians and the staff. We understand people want to stay at home. So when we think we can get away with that, we will. But there are times, particularly if a treatment change is needed, maybe a patient's arthritis is breaking through and they're not feeling well, and we're going to decide, are we going to change from one class of medicines to another? Very often that's a time where sitting with the patient and examining the patient, there's just no substitute for it. Sometimes patients have painful conditions. So they may not be life-threatening or that serious, but a bursitis of the shoulder or the hip, if you've ever had it, can be a disabling kind of condition. So you could live with that for a week or two or three, but after a while, that's going to really be egregious and interfere with your life. So we may say, okay, you're going to come in, we're going to get that shoulder injected and get you out of the office in 5 minutes. So this goes back to the previous question. It's a conversation between us and the patients and vice versa. And if the patient feels they need to come in, we'll consider that with them. If we feel they need to come in, we'll explain why, and we'll go through the safety steps so that we're sure we're giving the best possible care and the safest care.
Great, thank you. And so again, keep channels of communication open with your healthcare providers, what is most important. We have about 5 more minutes. I'm looking at the clock here, but I just want to squeeze in 2 additional questions, if that's okay, before we can wrap up with key takeaways. Dr. Kimball, can you talk a little bit about vaccinations. We're all eagerly waiting for the big vaccine to come along. But particularly for people with, generally vaccines are tested in the general population, healthy populations. So what is some of the important information for patients who have underlying conditions who might be immunocompromised? What is some of the important information, expectations that they might have around vaccinations? Would you be able to talk to that briefly?
So the CDC does have a vaccine planning unit, is working on kind of plans for dissemination of vaccines once they are developed. Most of the work to actually make and test vaccines is being coordinated by the National Institutes of Health, or the NIH. And then the Food and Drug Administration, or the FDA, that's the group that really regulates vaccines in the US. So vaccine development is happening right now. There are multiple phases. Phase 1 tends to involve small groups of people receiving the vaccine to see if it's safe, see if it seems to work. Phase 2, they expand it to several hundred people to learn more about side effects and how the people's immune systems are responding. And then in phase 3, the vaccine is given to even more people, and it's tested for efficacy, which means how well it works, safety, and learn even more about side effects. People with underlying medical conditions are sometimes included in phase 2 and phase 3 trials, but that does depend on the study design. Unfortunately, I don't have a lot of more specific information to share about the development of vaccines against the virus that causes COVID-19. I can tell you that everyone is working as fast as they can to make a safe and effective vaccine for COVID-19.
Yeah, thank you. And that's a great message of hope, is that we have the greatest minds today working together to find a vaccine for this virus. So fingers crossed on that. Dr. Max Hamburger, one last question for you. What exactly can patients, or maybe what can patients expect if they're immunocompromised and they contract the virus? Are they, for example, more likely to be hospitalized from serious infection? Are they more likely to develop severe complications from infection? Is there any information that you can provide on that?
So that's been a very interesting learning experience for us, because at the beginning, we feared that patients who have rheumatologic conditions might have an altered or a higher risk. And I think here's a concept. There are some concepts that are a little bit complicated, but want to try and make sure patients understand. Many of the conditions that we treat do involve the immune system, because the conditions are manifestations of inflammation. And inflammation is one of the ways that your immune system helps to kill bacteria and viruses and other pathogens that might attack you. For many patients, although the diseases are diseases that are caused by their immune system is actually mostly overactive. So when a patient has arthritis, rheumatoid arthritis, and their joints are swollen, that's because of an overactive immune system. If a patient has lupus and their kidneys or their skin or other organs are inflamed, that's because the immune system is overactive. The one way that the immune system was underactive was that it didn't realize that it was attacking its owner. So our immune system should like us, and it should only get angry when something gets into this that shouldn't be there. But in the case of many of the autoimmune diseases, the immune system attacks the patient, and all the symptoms, the patient is now learning just how aggressive the immune system can be. So we use medicines to try and balance the immune system, and sometimes these medicines do suppress the immunity, but if we've done the job as carefully as we can, luckily, most of the time we get it back to balance. And so briefly, what we've seen, looking in data in Europe in particular, where they've been ahead of us in terms of experience with this, but now in the US, is that we are not seeing that our patients are getting COVID more often, and we are not seeing that they're getting sicker with COVID. And in fact, it seems to be that maybe our patients are a little bit underrepresented. So in many cases, there are fewer patients with rheumatoid arthritis and psoriatic arthritis and lupus than we might have expected. And there's a lot of guesses as to why that might be. But, patients may have heard that some of the damage that occurs in the lungs, for example, is because of the overactive immune system and not just the virus. So the news is not so bad as we might have thought. The one drug where people need to be really careful and not play around with on their own is if they're on prednisone or some form of cortisone, because that's the one medicine which has turned out that in higher doses could be a risk. But I don't want patients to be afraid of their medicines because there's been a lot of scare about the medicines. I don't want them to be afraid. If they are afraid, call your doctor, because the good news, it turns out, is that this has not turned out to be nearly the worry for our patients as we might have thought.
Great, and that is some encouraging news, but I also want to reiterate your point and Dr. Kimball's point as well, is that we're learning. This is something evolving. We're learning every day. We're learning something new, and science is teaching us something new. So we'll keep patients posted on the new learnings that come through with data collection, etc. So I'm seeing a lot of questions come through as well. And again, apologies for not being able to address all your questions. We will, however, address them and have them posted up on our website at CreakyJoints or Global Healthy Living Foundation. Before we wrap up this absolutely excellent session today, I wonder if we could wrap up with some key takeaways. So Dr. Max Hamburger and Dr. Ann Kimball, if you were to want patients today to go away with one or two key messages, what would they be? And we can start with you, Dr. Max Hamburger.
One key message would be that the means of protecting yourself are pretty simple. They've been publicized a ton. Wear a mask, socially separate, clean your hands, wear gloves. These are not complicated, they're basic. Obey them, stick with them, protect yourself, protect the people around you. Think about the 6 degrees of separation question. You want to know not who just you've been with, but the person you've been with, who they've been with, and who they've been with. Be careful. If we're careful, we can largely prevent ourselves from getting this infection. And the other important message is communication. Communicate with your doctors. Ask questions. There's no stupid question. There's no dumb question. Every question is a good question because it all goes to, and I'll close with this, what you just said. We've known about this illness since December. We are learning an enormous amount. There's much more we have to learn. The only way we're going to learn that is to talk with each other. That's how we'll learn. So keep the communications going.
Fantastic message. And Dr. Ann Kimball, might you want to add to that?
Dr. Hamburger said most of it. I guess the only other thing to add, as we are learning more and more about this disease, I would recommend people to, look for good sources of information, such as CDC's website and the information that Global Healthy Living Foundation is putting out. And we do know that as people get older, the risk of severe illness does get older, and there are some underlying medical conditions that seem to put people at higher risk of severe illness. And most importantly, stay in touch with your healthcare providers. As Dr. Hamburger said, don't ghost them, don't ghost us. Stay in touch, and you can have good conversations and shared decision making to keep you as healthy and safe as possible. And please don't delay seeking care if you do have a medical emergency.
Great. So let me count these out then. Pay attention to your underlying condition. Make sure you stay in touch with your doctor. Communicate. Keep all channels of communication with your doctor open so you can manage your underlying condition. Discuss any concerns, any anxieties you have. Don't make the decision of what's important and what's not yourself. Consult your doctor and listen to evidence-based information. And again, we encourage you to go to CDC's website. GHLS has a great patient support program, which we encourage you to join. So do stay connected with us to receive updates from this Facebook live visit, as well as on other opportunities at www.ghlf.org. Once again, thank you very much to our panelists for all that wonderful information, science-based information. Thank you to our audience for your patience, for sending us your questions. We will respond to them. And I just want to end by saying we're all in this together. Stay safe, keep courage, and we will get through this. So thank you, everyone, for joining us today.